I had a radical prostatectomy, and I decided that after consideration of the other options, which were brachytherapy, wait and see, external high beam radiotherapy. But I felt at my age, at that stage I was not quite 65, and I felt that I was still in the bracket where this cancer could spread and get outside the capsule. So I decided I'd rather have the whole of my prostate out and finish with. And I decided that, and away I went. Well, firstly, I felt if I had the other things, like say the brachytherapy, I wasn't confident that that would be sufficient to get rid of the tumour. The other one, which was external high beam radiation, in Australia, it wasn't at that stage totally efficient, and I looked up the stats and I spoke to people who'd had it, and they had complications after that. And so I spent with the oncology man a good hour of his time, and during that time I decided, no, I would like to have this tumour out, thrown away, finish. I think fundamentally it was myself, because I'm a doctor, and I was able to understand, I think more clearly, it was myself. I discussed it with my wife and the surgeon, of course, and I've already said the oncologist. Immediately after the operation, it was a bit difficult, more painful than I thought. I'd forgotten how radical the surgery was. But I recovered from that. Then I was incontinent of urine, quite badly really, which I was surprised at that. I felt that I wouldn't be. I was told that it wasn't, best practice was about 3 or 4%, and I must have slotted into that 3 or 4%. When I spoke to the surgeon about it, he said, well, there was a difficulty because the cancer on the right side of my prostate was getting very close to the capsule, and he had to sacrifice one of the nerves on that side for fear that if he didn't do that, the cancer may spread later on. So I accepted it, of course. The incontinence then, when I got out of hospital and went back to my normal way of living, was extremely difficult because I had to wear protective pads, change them regularly and things like that. So after a little while I rang the surgeon and I said, look, this is just a bit uncomfortable, you know, I can't, playing golf, for example, was just about impossible. And going to work, if I got stressed, the same problem. So he said, come in and we'll try something. And I went to him and he gave me an injection of a substance called collagen into my urethra, my penile urethra. And he said, I think that should work. Well, it didn't work. So I waited another, I forget how long, maybe 6 weeks, 2 months. Rang him again. He said, well, maybe we should give you a higher dose of this collagen. Maybe it wasn't enough. So I went back again, same procedure. This time there was a marginal improvement. It was only marginal. It still really wasn't satisfactory. So I thought, I'm stuck with this. I'll just have to live with it. But I got a bit sick of living with it. So I rang him again and he said, there's this new treatment, this Invance sling. It will need you to be operated on again, cut this time and so on. So I went to the urologist and we discussed this new technique, which was this thing called an Invance sling. It did mean that there was going to be an intrusion again. I had to have another operation, not as big as the first one. So I said, look, let's do it. I had it done. It was a little bit of pain and discomfort for a few weeks afterwards, but to me it was a great success. Occasionally under a little bit of stress I might leak a little bit of urine. Sometimes if I have a couple of beers I might leak a little bit of urine, but fundamentally I can get away almost most days without wearing any protection at all, and I consider that to be a marvellous thing. So I support the Invance sling. It's really made a big difference to my quality of life. For example, I can play golf now, and I might sometimes wear a little pad just in case, but I can tell you before this, if my golfing mates would joke with me and say, are you going to change the nappy at the 4th hole or the 6th hole? Because I really would have to go in the bushes and change this soaking, pad. So it's made an enormous difference, and it's made a difference to my confidence. I was starting to lose confidence. I started to think, life is not so good anymore. But since then, my confidence has come back, and I attribute that to this particular surgery that was done, this Invance sling. I would say I'd have this, if they had what I was having, this incontinence, I would say without a shadow of a doubt, you go and have this Invance sling done. Because even though it's an operation and you're a bit uncomfortable for a little while, it passes, and it worked for me. I can only assume that at the time the surgeon said to me that the experience overseas was that 100% of people got 85% improvement, and something like 85% of people got 100% improvement, or some numbers like that, you know. And I think it's probably right, you know.